we started a couple of months ago with a supplemental screen. When inmates come into jail and they're arrested, we ask them questions about symptoms. We check them for a fever. We check to see if they have symptoms of cough, shortness of breath, fever, chills, body aches, things like that. We ask about exposure history to COVID-19, and we ask about travel history. We put those individuals who are at higher risk based on that questionnaire and based on history and physical exam into medical observation housing. That's also known by the CDC as medical isolation housing. And we keep them separated from other people while we're testing them and monitoring their symptoms along the way. As we've evolved over time to identify people who are at high risk for COVID-19, we've come to realize, as we've seen these positive cases build up, that we also need to do contact tracing within the jails. And that's where that close partnership with MCSO comes into play. When we have patients who are who have been found to be in close proximity to individuals who test positive for COVID-19, we request special housing. We put them into medical quarantine housing where we can observe these individuals. And as of now, we are testing every individual in quarantine housing and identifying with the full realization that some people are going to be positive for COVID-19 and not have any symptoms at all. That's something that we've been hearing from the CDC and Department of Public Health as well, that many, many people are out there with probably infections of COVID-19, and they don't have any symptoms at all. And we're taking close precautions for those individuals as well. As soon as we identify that someone is positive for COVID-19, even if they don't have symptoms, they are also going to be put in medical observation housing.